Good morning students. Today we are going to discuss the mandible. In this video I will discuss the parts of the mandible only. Mandible is made up of two halves, that is right and left, and the meeting point of these two parts in the center is known as the mental protuberance. Now if we see the mental protuberance, it is a triangular area. The inferolateral part of this triangular area is known as the mental tubercle. So small elevations are present over here. Now when the fusion it happens, now this is the body of mandible and these are two rami then. So what are the surfaces and border of body? It has anterior surface, it has posterior surface, it has superior border which bears the socket for teeth, and this is the inferior border which is known as the base of mandible. Now on the anterior side, as I have told you, there is a mental protuberance in the center and mental tubercle at the inferolateral end of this mental protuberance. So this is known as the mental tubercle, and there is one foramen lying over here. This is known as the mental foramen. Now on the anterior side, there is an oblique line which is coming from the anterior border of the ramus. Now coming to this ramus portion. This ramus portion has anterior border which is sharp, which is continuing anteriorly with the oblique line on the body of mandible. It has posterior border. With this posterior border is continuing with the base of mandible at the angle of mandible. So this is known as the angle of mandible. It has lateral surface, it has medial surface. Now the lateral surface is giving muscular attachment. So on the medial side again muscles are there that we will discuss in our next video. And on the inner side you can see, so there is one foramen which is visible. This is known as the mandibular foramen. This mandibular foramen, it shows the projections on the upper portion, and that projection is given the name lingula. To this lingula portion the sphenomandibular ligament is attached. So what are the other structure present on the inner side? You can see this crest-like structure. This is the mylohyoid line, and behind this mylohyoid line a groove is present which is known as the mylohyoid groove. Now as we go more superiorly, this ramus of the mandible has two processes. So these are the coronoid process. This is the coronoid process and this is the condylar process. Now this condylar process has head, which is known as the head of mandible. Then it has a constricted area which is known as the neck of mandible. This head of the mandible, it articulates with the mandibular fossa of the temporal bone to form the TM joint, and it is covered by fibrocartilage. Now this is the coronoid process. This is triangular projection which is present anterior to the head of mandible. Now you can see a notch present between the coronoid process and the head of mandible. This is known as the mandibular notch. So these are the important structure which are present on the outer and inner side of ramus. Now coming to the inner side of the body of mandible. On the inner side there are four tubercles are visible in the midline. So these are known as the genial tubercles. So there are two superior genial tubercle and two inferior genial tubercle. Now if we see the mandible from the inferior side, you can see here, you can see two fossae they are present. This is known as each is known as the digastric fossa. Now this digastric fossa is giving attachment to the anterior valley of digastric. So this is all about the structure of the mandible. One thing important is that this mandibular foramen, it is passing through the part of the ramus, and the another end of this mandibular canal is the mental foramen. So these are the different parts of the mandible. Now what are the important nerves related with the mandible? To this mandibular notch the mesenteric nerve is related. Through this mandibular foramen the inferior alveolar nerve and vessels they pass. So as they are just passing through this, before that they give one nerve, that is nerve to mylohyoid, which is running in this groove. And behind the molar tooth on the ramus of the mandible, here the lingual nerve is related. So that is again very important nerve. Now to the medial side of the head of the mandible, the auriculotemporal nerve is related. So these are the important nerves which are related with the mandible. Now coming to the ossification. Now the mandible is the second bone in the body which is ossified. So first bone is the clavicle, you know it. So this the primary center which is appearing for the mandible, that appear by the age of 6 weeks. So some part of this mandible, they just you can say ossify in a membrane. So what are those parts? That is the coronoid process, this condylar process, and the superior part of the ramus portion, and the area just around this incisors. So these areas they develop, they have the intramembranous ossification. Now, as the center, it appears that is by the age of 6 weeks of intrauterine life, it is just appearing in near this mental foramen. So later on, the whole of the mandible it get ossified and become bony by the age of 1 year. So by the age of 1 year, the bony component it develop from mandible. Now, what is important for the mandible, that is age changes in the mandible. So it has very medical legal importance. So how can you know the age of this mandible? Now, what is happening in infants and children in initial stage of the age? So alveolar sockets are present, and this mental foramen it lies near the alveolar socket. But this portion, that is the area below the mental foramen, it is not developed. So it appears that this mental foramen it is lying near the inferior border of the mandible. So secondly, this angle which is formed by the posterior border of the mandible with the body of the mandible, this is obtuse in case of infant, because the body is this ramus is little bit horizontally placed. Now, as the age advances, the ossification it happens. It is happening at both the portion, that is in this alveolar region as well as in the subalveolar region. So, what is happening? The mental foramen come and lie in the center of this bone. So, that is in the adults. So, what is happening in old age? An angle is acute in case of adults. And what is happening in old age? The shedding of the teeth it happens, and later on the resorption of the alveolar sockets it happens. So definitely so this portion of the bone is gone. So the mental foramen come and lie near the upper border. So these are and again in old age, because of the resorption of the different component of the bone, the angle again it become obtuse, that is nearly 140 degree, and in adult it is around 110 degree. So that is important landmark. If the mental foramen is lying near the lower border, definitely that is the mandible belongs to the infant or child. And if it is lying in the center, this is the mandible of the adult. And if this mental foramen is lying near the alveolar sockets or upper margin, it is the mandible of aged person. So these are the important things regarding mandible and the different attachment that we will discuss in our next video. Thank you very much.